So I was born with cystic fibrosis, which is a chronic, genetic, and fatal illness. And for my first 16 years of my life, I would go to clinic at Children's Hospital. And then at 16 years of age, because I'm kind of a broad-shouldered guy, I could no longer really fit on the x-ray machines. And so I requested to be transferred over to St. Paul's, where the adult clinic is. My doctors had told me at the beginning of it that waiting for a double lung transplant is one of the most stressful things a person can go through, and he was very right. During that time, my health really began to decline, going from 27% lung function down to 20%, and yet the transplant wasn't happening. And so as you're waiting for a transplant, you're getting sicker and sicker. You're spending more and more time in hospital, but there's nothing that you can do to make your transplant happen, and so you are essentially dying. I was going through respiratory failure and just hoping that one day I'd be able to receive this precious gift of life. And so you're living in this constant tension of despair, I guess, some mild depression, wondering if I would ever receive this gift of life, but then also the incredible hope that a transplant could bring. I remember waking up at 5 a.m. as I heard some noise in my room, and 5 a.m. was the regular time that my nurses would come in and start my first IV of the day. But when I kind of rolled over to see what was going on, there was 3 people standing in the doorway, and one of them was my nurse. There was also a second nurse with her who I knew well, and also a member of the IV team. And my nurse handed me a piece of paper with a phone number on it and said that my call had come. I've always said I would not be alive if it hadn't been for St. Paul's and the care I received there. One of the reasons I chose to work at St. Paul's is because of their mission, to treat all people with respect, to see all their patients as having their own dignity, their own humanity, as even though they are in this institutional setting where that can so easily be stripped away, your humanity and your personal stuff. The staff always went beyond what was called for, treating all their patients with respect and with dignity and seeing them for who they are rather than just someone laying in a bed. For someone who is in care and beginning to lose hope, I think what I would say is that what they are going through matters. Their life matters. They have an inherent dignity within themselves. They have an inherent life that has made and can still make an impact within the world, even though their world has maybe become as big as a hospital bed or a hospital room. But that they still have an incredible dignity and gift of life, and gift of life still to give. Whether they find themselves alone in life without family or friends, or whether they're surrounded by family and friends as I was, and yet I still felt incredibly alone. People do still care. And if they don't have anyone, then the staff at Providence does care.